Many typical experiences of being diagnosed with heart disease involve being put on prescription drugs and told you will have to take them forever. It's also really common to be told that the cause of heart disease is mainly genetic. But what if we see the disease from a different perspective? To understand heart disease, let's first understand the heart's function. All parts of our body require a constant supply of blood. Organs, like our brain, are busy working away and require the oxygen and nutrients the blood carries. Then, in order for the blood to get around the body, it will travel in blood vessels. And the heart is the center of this whole system. Acting as the pump, it will pump our blood through the blood vessels all around the body. Heart disease is what happens when something somewhere in this process goes wrong. And the two most common forms of heart disease are atherosclerosis and heart attacks. Atherosclerosis is the most common and is often the precursor for a heart attack. It is the narrowing of our blood vessels over time. This generally happens, first of all, because some kind of damage happens to our blood vessel walls. The damage often comes from things like having blood pressure that is too high, chronically smoking, drinking alcohol, or having inflammation in the body. The body then seeks to repair the damage. However, in people who have high cholesterol in their blood, which is another name for high fat, this repair process can cause further problems. The cholesterol clumps to the damaged wall and results in plaques being formed. Over time, the vessel wall will become stiffer and stiffer, and this means the blood vessels are not going to function as well, and are more likely to get blocked. Blood then can't pass through the blood vessel. In conventional hospital medicine, the causes of atherosclerosis are generally considered to be the aggravating agents of high blood pressure, smoking, and alcohol, as well as high-fat diets which are thought to contribute to the high blood cholesterol levels. The traditional treatment would be to prescribe blood pressure and cholesterol-lowering drugs, and if you're lucky, some advice to stop unhealthy lifestyle habits. You might also have surgery to either introduce a stent, which widens the space in your blood vessels again, or a coronary bypass which redirects blood flow through an alternative route from your blocked blood vessel. Then what about a heart attack? What is it? Well, it's very much related to atherosclerosis. Atherosclerosis narrows and potentially blocks the blood vessels. Often, the vessel becomes further blocked because a blood clot forms, which then gets trapped in the vessel amongst the atherosclerosis plaque. A heart attack happens when the vessels become so blocked that blood cannot get through. As blood cannot reach the heart, it cannot be pumped, and our body suffers without oxygen. Heart attacks often happen when we're under pressure or stress. This is particularly dangerous because at these moments, we're in need of extra volumes of blood, yet our blood vessels are too blocked to provide it. Typical treatment for someone at risk of heart attacks would include the same things as those for atherosclerosis, as well as anticoagulant drugs to prevent blood clots. But, we said we wanted to see heart disease from a different perspective. If this is how current conventional medicine sees it, and treats it, then what's missing? Well, these traditional factors linked to heart disease only actually account for 1/3 of the risk of heart disease, so we must be missing a large chunk of the associated factors. What we really need is a bio-psycho-social understanding. Because in fact, our bodies are programmed by psychosocial factors, especially during childhood. The way our biology will behave depends on what happened, and is happening, to us by the environment. If you remember earlier, we mentioned blood pressure can contribute to both atherosclerosis and heart attacks. Well, your blood pressure responsivity, which is how much blood pressure is receptive to and increases in response to, for example, stress, is coded during our childhood. A stressful childhood can mean a high responsivity. As an adult, small matters of stress can then hugely increase blood pressure and therefore increase heart disease risk. Likewise, our stress hormones get programmed in our childhood. That is the amount of stress hormones and again the responsivity of them. And that is hugely important because recent studies have been showing that dysregulated stress hormones not only predict atherosclerosis presence, but also severity. And beyond stress hormones, what also gets programmed during childhood is our emotional development. Whether we can healthily feel, express, and regulate our emotions. The expression of rage is something that has been linked with heart attacks. Rage is different from its cousin, anger, in the sense that anger is a healthy expression of boundaries, whilst rage is aggressive. In fact, rage actually is a form of anxiety, and anxiety in truly being vulnerable with the emotional vulnerability of our pain and anger. Parents who shame their child for expressing anger during their development can cause this long-term anxiety when it comes to anger, and resultantly a personality prone to rage. More deeply, we also develop our stress management skills. This includes not just emotional regulation, but also our habits. Our doctors can advise us to stop drinking alcohol and smoking, or to eat healthier, but it is often poorly understood that stress management underlies them. We overeat unhealthy foods because they're comforting, or smoke because it's a way to cope with life. Evidently, deeper than the surface level assumptions of what was thought to cause heart disease, we can see childhood development is, in fact, an important part in shaping our biology. But, our heart health is also affected by real-time bio-psycho-social programming in so many different ways. The amount of meaning and purpose you have in your life is associated with atherosclerosis severity. And so is your level of depression, as well as your balance between stress and relaxation. Having poor circadian rhythms, which means being out of tune with normal daylight and eating cycles, has been shown to induce chronic inflammation. Then chronic emotional activation has been shown to induce heart inflammation. And when it comes to our chances of dying from cardiovascular disease, your self-perceived age, so how old you feel inside, and not necessarily your real age, predicts your mortality. The mind is a powerful tool. These factors are not just associated with heart health, they are actually, even more, important than conventional factors. Stress, for example, has been shown to counteract the vitamin C you would get from a healthy diet, depleting it in the body. In another study, going through the stress of multiple job losses was more important for heart disease than even hypertension, smoking, and alcohol. And in another, levels of job strain were more important than cholesterol, smoking, and hypertension. But the extent of biopsychosocial factors being important in developing heart disease is just one side of the picture. They are also important in the healing of the heart. Optimism, positive emotion, levels of sleep, and whether or not you have a caregiving responsibility, have all shown to affect your recovery time from heart illness or heart surgery. So, remember through your journey with heart disease, that heart health is about much more than just what the hospital will tell you. And you have plenty of factors in your control, other than just the prescribed medicines.